name's Natalie. I'm an occupational therapist here at Census Australia.
And my name's Brianna. I'm a senior speech pathologist at Census.
We thought we'd chat with you today about some of the great feeding therapy options that we have available here at Census Australia. Here at Census we work with families to achieve the goals that they have for their children, and as part of this we often come across families who are having difficulty with meal times. It's just so common.
Children can be having difficulty with meal times for a variety of reasons, anywhere from oral motor difficulties, which is difficulty with chewing and swallowing, children who are struggling to put on weight, kids with sensory processing difficulties, all of which can make meal times really tricky for families.
So some of the common areas that could indicate that your child or your family would benefit from feeding therapy is that they have a limited variety of their diet, so whether that's texture or taste, often they can even refuse entire categories of food groups. Also kids who have issues with weight gain, so they're poor weight gain or are underweight themselves. Also children who are transitioning from tube feeding to oral feeding as well. And as well, those families where just mealtimes are a bit of a battle. They just find mealtimes distressing for one reason or the other. Any of those families would really benefit from feeding therapy.
We use lots of different strategies when working with families. One of these is called SOS feeding therapy, which stands for Sequential Oral Sensory Approach. This program was developed by Dr. Kay Toomey in the States. It's an evidence-based approach, training therapists from all over the world, and there are a number of therapists at Census who are trained in this approach.
So the SOS approach is a transdisciplinary approach that assesses the whole child. So we use it to pinpoint the reason or the reasons why a child is having difficulty with that skill of eating. So the approach looks at increasing a child's comfort level by interacting with the food in a really playful and fun way. So starting from just being able to tolerate food in a room and then tolerating food in front of them, to touching the food, to licking the food and eventually tasting and eating the food. All whilst considering a child's oral motor skills, their sensory processing preferences, the way they're seated in the chair at the table as well.
Many people think there are only 2 steps to eating, picking it up and eating the food, but in actual fact there are 32 steps to eating, and we take the child along the process of looking at all of those steps. It's a really fun, play-based approach, absolutely no force feeding at all.
Then for those older kids, normally about 8 years and older, we use a program called the Food Scientist Program, which is basically a modified version of the basic SOS program. In this program we are food scientists and we explore the different properties of the food. We learn more about the food, the importance of why we need to eat it, and the importance of eating from all the different food groups as well.
At Census Australia, often speech pathologists, occupational therapists and dietitian are involved in mealtime therapy, but also there might be involvement from a physio or a psychologist depending on the need of the child and the need of the family. Each discipline has a different and specialist knowledge regarding feeding therapy. Speech pathologists will be looking at the oral motor, so like the chewing and the swallowing of the food. Occupational therapists will be looking at the sensory processing preferences and how we can prepare our bodies for eating. And a dietitian might be looking at the food groups that the child is needing in their diet and where to start. So depending on the need of the child and the family, you might see one therapist or you might see a whole group.
So as you'll see in this video, we work with children in a variety of settings. So sometimes it might be at the family's home or at a school, daycare centre, or in our clinic as well, depending on the preferences of the family. So we work with children, adolescents and even adults as well, with a variety of disabilities or delays.
We hope that you've enjoyed this little insight into some of the great work that we do at Senses Australia. If you like what you've seen here and you feel like your child might benefit from feeding therapy, then get in touch with us today.